Welcome to Ethical Reasoning for Cardiovascular Technology students. This training will take approximately 60 minutes to complete. Headphones are suggested because there's audio throughout. To advance slides, click on the Next button on the screen. There will be knowledge check questions throughout the training. Please be sure to read and listen to all content to ensure that you can answer the questions correctly. The objectives for this Ethical Reasoning for CVT students training are: given a web-based, self-paced e-learning module, the cardiovascular technology student should be able to 1. Recognize the ethical concerns relating to a specific issue or issues as they relate to the health sciences without error. 2. Identify one's core beliefs in relation to an ethical issue or issues as they relate to the health sciences without error. 3. Apply alternative ethical perspectives to one's own in relation to an ethical issue or issues as they relate to the health sciences without error. This course consists of 2 lessons, Values and Ethics. Click on each image below to hear about the relationship between the two. Values can be defined as those things that are important to or valued by someone. That someone can be an individual or organization. Scroll over each image to see what some of the sources of values are. What are your core values? Look at what your own personal values are. Use this list to help determine your core values. Use this list to help determine your core values. Think about what values resonate with you. From the list below, think about what values resonate your selections. As you read through don't overthink your selection. Just think about the words as you read through. Just think about the words that you feel are a core value to your personality. Choose 4 terms that will reflect your 4. Read over the list values and choose one value from each column that reflect your core values. When working for a healthcare organization, it is integral to find a connection and balance between your personal and organizational values. This is a list of the values of 2 of the clinical sites we work with. Do you see any overlap in your own personal values and the values of these healthcare organizations? Click on the links below to read more about the mission, vision, and values of these organizations where you possibly could go to clinicals. Up to this point, the lesson has addressed the definition and development of values, personally and professionally. Key healthcare values were introduced as well. We will now look at ethical reasoning and how values influence the choices you make in the field. Read over the material about the Code of Ethics for the healthcare worker and click on the link to read the RCIS Code of Ethics from Cardiovascular Credentialing International. You will have to answer questions about the CCI Code of Ethics on the next few slides. The guiding principles of medical ethics are important when you're faced with an ethical dilemma and have to make decisions that are in the best interest of your patient and their rights and values. Click on each principle to read its definition. After reading the definitions, watch the video in the bottom left-hand corner of the screen. Some situations may require immediate action to prevent serious harm to the patient in an emergency. The medical professional can only make decisions for the patient if the patient is unable to give consent, they do not have a decision maker available to act as a proxy, and there is no advance directive. Listen to this ethical dilemma and think about which ethical principles come into play here. An 18-year-old patient arrived in the emergency room with a pericardial effusion. Fluid is surrounding her heart rapidly, and she's in cardiac tamponade and now unconscious. Her vital signs are declining, and she may die without the procedure. She has no family members with her, and there's not time to find a substitute decision maker. Because it is an emergency, the doctor decides to perform the pericardiocentesis right there in the emergency room. During the procedure, the right ventricle is punctured, and the patient will need a blood transfusion immediately. The doctor calls for whole blood. The nurse chimes in and explains that when looking for patient identification, she found a recently signed card from a Jehovah's Witnesses church in the patient's purse. The card states that she refuses blood transfusions. What would you do? Click on the next slide to look at how the ethical principles can help make a difficult situation more clear-cut. Click on the numbers 1 through 5 to see what ethical concepts come into play in this case.